Hey guys, and welcome to Shalom. So today we're going to be talking about what it was like in the intensive outpatient program that I went to when I was 16 and 17. I'm making this video mostly for people who are either in an IOP program or are thinking about going to an IOP program, and of course people who are just interested in knowing what it was like, but most of the things I say are going to pertain to people who are currently in an IOP program or are in therapy of some sort, or exposure and response prevention therapy specifically. Also, I'm assuming that your IOP program is going to be doing exposure and response prevention, but I recognize that I don't really know that. But hopefully you can take what I tell you and kind of apply it to your own situation, whatever it may be. Before I get started, let me tell you what an intensive outpatient program is. So there are a few different types of treatment in a mental hospital or a mental health clinic. It starts at traditional outpatient, and then intensive outpatient, a day program or partial hospitalization, residential program, and then an inpatient program, which is the highest level of care. In this video, I am talking about an intensive outpatient program, which is typically a few hours a day. Mine ran from 3 to 6. And sort of functions as an after school or after work type of thing. Now, let's get started. The first thing I want to point out is that nobody can make you do something you don't want to do. I think that was my biggest fear when I was going to the IOP program. But the thing is, no one is going to make you do something that they're not going to do themselves. They can never put you into any type of legitimately dangerous situation. Even though it might feel dangerous to us, it's really often not. And if you do encounter someone trying to make you do something you don't want to do, this leads me into my next point, which is to have 110% honesty with your treatment staff. You need to be honest with your doctors and therapists if you want to get the proper help. The point of the program is for you to leave with less anxiety than when you came in. Now, therapy won't always seem like you're going to have less anxiety, but trust me, you most likely will. Also, compromise is very important. Odds are your doctors will tell you to do something that you really don't want to do, but they're only doing this because they know it will help you to recover from your OCD. So be honest with them and try to compromise if you think that something is too hard or you don't want to do it for whatever reason. My third point is that therapy will be challenging. Exposure and response prevention therapy may be the hardest thing you'll ever have to do, but it has the greatest reward, living life without OCD. Or at least without having to do a compulsion every 5 seconds, which is what my life felt like before I went into my IOP. Also, at the IOP, they won't coddle you. You are not there to do your compulsions. You are there to work on your OCD. So yeah, maybe at times they'll push you not to do a compulsion, but it's for the greater good, your mental health. My next point is that you'll probably end up spending more time with the therapists and like them better than you like the doctors. Doctors are great and helpful, but they're the ones who make up your treatment program, and they might tell you things that you don't really want to hear. So you'll probably end up preferring the therapists who just carry out the doctor's orders. Therapists are also the ones who are always around, and you may end up talking to them and doing exposures more with them than with your doctors. Now I'm going to go over some of the more technical things in the IOP program, at least for mine specifically. So this is how mine went. There were therapists, psychologists, and psychiatrists. The psychiatrist and the medical director will handle medications and whatnot, things psychiatrists do. You also might talk to them on occasion, but not very often. The psychologist you had an individual meeting with, I think twice a week, and then a family meeting once a week. And that's when your family would come together and talk with your psychologist and sometimes the psychiatrist as well. And then there are the therapists who are always around in the therapy area and are always there to help out with an exposure or a group or whatever you're doing. While in the program, a couple days a week we had art therapy, which is basically where we did arts and crafts related to treatment and recovery, and sometimes we would just make our OCD with different mediums. We would do all sorts of arts and crafts. We could make puppets, puzzles, we could paint. One time we made a mandala out of spaghetti, so that was probably the most interesting art therapy group of my life. Also, one day a week we had group therapy, which is basically a time for the patients to talk to each other about how their recovery is going, how treatment is going, and other things in their life they may want some advice or opinions on from the other group members. There was also exposure group, which was where all of the patients would sit in a room together, which is basically our main room where we did all of the stuff in, but we would sit in that room and we would do exposures in the presence of the other patients. And there were times where we could go with our psychologist and do an exposure, or with a specific therapist and do an exposure with them alone, but a lot of the time we were just in the room doing our exposures together. Also, while we were in the program, we all got these little books called boss books. I'm holding it up like I have it in my hand. I don't. Those boss books were basically a way to track when we boss back to OCD. So when we do a compulsion, we would mark down that we did one, and we would have pages. Well, actually, I can show you. I have my boss book that I made up right here. This is what a typical boss book page looks like. You have the obsession or the compulsion up here, and then you put the date in this column, you put your resists, submits, and re-expose in these columns, and as you can see, if you do a resist during that day, you would put a tally mark for resist. If you do a submit, you would put a tally mark for the submit, and if you do a re-exposure, you would put a tally mark for that. That's basically how that worked. It's pretty simple. And then every day, in the beginning of program, we would have a check-in group, which is basically where we're just checking about our day. And we would tell whichever therapist was leading check-in what our boss book looked like for that day, so how many submits we had, how many resists, and how many re-exposures, and we would also tell them about the exposure homework we did. Every day we would get homework where we'd have to do an exposure on our own before the next session. Hi guys, so I'm coming to you again at 11:53 p.m. because I realized I forgot the most important part of my IOP program. It's probably the most interesting part, was that the therapist actually came to our houses to work with us. So the therapists would come to our houses to do exposures with us. Some people would actually have to stay in apartments or hotels because the treatment was so far away from their house they couldn't be driving every day. And in that case, therapists would still go to the apartments and hotels, and it really made the treatment more helpful because there are so many rituals that can only be addressed in the house. So yeah, that was 3 times a week with a therapist, and that was extremely helpful during treatment. So yeah, that was basically what it was like in the OCD Intensive Outpatient Program. As always, if you have any more questions, leave them down in the comments below. Also guys, let me know what your experience has been in other OCD treatment programs. If it's an IOP program, definitely tell me what that was like, because I love learning about how other places do IOP programs, as well as other programs as well. Just give me all of your knowledge on it, because I want to know. I hope you guys are enjoying OCD week, and yeah, I will see you all later. Bye! Scenario. We all got these little books called boss books. I hope you guys are enjoying OCD week, and Woo!